So with me today is my daughter, Jana. Jana has been a hospice nurse for 17, 18 years right now. And when we lived back east, for a period of about a year and a half, we worked in the same facility. So just a real quick story here, how we begin with this, is that when I was living in New York and the kids got older and moved out, did their thing, we have 4 children, two daughters and then 2 boys. My 2 boys were active duty military for 7 years. They're both Iraqi combat vets. And so it was just Jerry and I, and my wife Jerry will be here later this evening for Mass and for dinner. But we decided to move to Maine because we had a cabin up there for many, many years. And this was camp. You know the difference between a cabin and camp. Camp has no electricity, no running water. This is camp, you know. And so we decided we're going to move up there and kind of live in the real rural, end of the world kind of lifestyle. And that's what we did. But I needed a job. And because I hadn't really met that many people up there, I knew several priests and met some of the fellows downtown in Portland Diocese. And I prayed. And I said, Lord, I can do a lot of things. I can teach, I can do this. The only thing that I don't really want to do is to do any kind of hospital or like nursing home ministry. Other than that, Lord, put me any place you want. And that's what I prayed for. And then we sold our house, and I contacted the priest that I'd been in contact with, and I said, hey, Father Phil, guess what? We sold our house, we're coming up to Maine, I'm ready to come work in the parish with you. He goes, well, that's awesome, except I just got transferred to the other side of the state. I'm like, oh man. He goes, but I have the name of the new pastor. Go talk to him. I told him all about you. Great. So I met Father Joe, we went up there, and he said, Steve, I don't have any money. Because you can be the deacon here, it's great, but I can't pay you anything. But you know, about 7 or 8 miles away, there's this large Catholic nursing facility, and they're looking for a pastoral care director. And I said, really? And that's what I ended up doing for the next 4 years. And for 4 years, I was the pastoral care director for a big 138-bed Catholic nursing facility. I'll tell you a little bit about it in a moment. And Jana, with her skills, she ended up there as well. But it was an awesome opportunity. So just out of curiosity, how many of you go to visit hospitals or nursing homes? Almost everybody here. So you'll appreciate some of what we're going to share with you today, because that's a lot of what we do. We deal with people who are either at the end of life, difficult circumstances, and to be honest, it all comes down to one word, and that's hope. So let's pray together just to begin with. I'd like to just paraphrase for you Jeremiah chapter 29, verses 11 to 15. For I know well the plans that I have in mind for you, says the Lord, plans for your welfare, not for woe, plans to give you a future full of hope. When you call on me, when you pray to me, I will listen to you, says the Lord, and I will bring you back from all those difficult places. Good and gracious God, for however many times that we have been bedside with people, or we have been going to someone's home who is dealing with a terminal illness, let us recognize that it's all about hope. Hope in you, hope in the great physician, Jesus Christ, hope in the resurrection, and hope that you will take us where we need to be. We ask this through Christ our Lord. Amen. All right, Jana, why don't you tell them a little bit about yourself?
So as my father said, this year will be 18 years as a registered nurse. Majority of my experience has been in nursing home settings, skilled rehabilitation, long-term care, and a lot of time in hospice. I am currently certified as a certified hospice and palliative nurse, which is a national certification that I recertify every 4 years. I worked for about 6 years as a full-time hospice nurse, both out in the community, seeing folks in their homes, in nursing facilities, assisted livings, and then I worked in an inpatient hospice unit for about 4 of those years as well. We worked together at the one nursing home in Maine, which was wonderful because then if I had someone with pastoral care needs, instead of me trying to figure out what parish was closest by, I had an inn and I could just call down to pastoral care. One of the things, that I really appreciate with, having a pastoral care department or being able to reach out to a community parish is that so many people, I'm so busy taking care of the clinical needs. And there are so many other needs beyond that. So while I'm handling things like pain management or respiratory management or making sure they're not, nauseous anymore, or all these millions of things that I'm coordinating as a nurse, since we're the ones that are kind of pulling everybody together for the patient's needs, every patient is not just their diagnosis or what's going on with them clinically. They have so many other needs as a person, and one of those major needs is spiritual. And when clergy comes in, it is such a help to the patient, it's such a help to us as staff, because you're helping meet those needs that honestly a lot of times we would love to try to meet some of those needs, but we're not clergy, so there's a lot of things that we don't necessarily know how to do. But also, a lot of times we don't have the time to do because we are just running all day. So I just want to say thank you to all of you for everything that you do when you come to see patients, because us as clinicians, we really appreciate you.
So before we get started on specifics on hospital, nursing homes, assisted living facilities, the handout that I gave you, there's a couple of different things that if you don't have this information, or you'd like to refresh some information in your brain, there's 3 major documents of the church about preaching. And I've given a little bit of a summary on each one. So the first one that you're going to see is old in the respect that chronologically is from 1982. It's one of the first documents really that came out on preaching after the council. And you see it's 1982, so it's a ways down the road. But it's called Fulfilled in Your Hearing. And this was the first time that we had a major document after Vatican II. So the first paragraph that I have there might be a surprise. It says, the primary duty of priests is the proclamation of the gospel to all. It might come as something of a surprise to us because most of the time we think about priests as celebrating the church's sacraments, or the pastoral care of the people of God, or the leadership of a community. But the words of the document are very, very clear. The proclamation of the gospel is primary. So that's not only in preaching, but as Deacon Anton alluded to, it's how we live our life and how we enter into our relationship with other people. So, a key moment in the proclamation of the gospel is preaching, which is characterized by the proclamation of God's wonderful works in the history of salvation. And then the document goes on and it's laid out. Notice that the first thing that it goes to is the assembly. Who's in the pews? That's the most important thing to begin with. Who is it that you're preaching to? Then it talks about the preacher himself, a homily, and then a homiletic method. I'm going to go through this relatively quickly. The second document, Preaching the Mystery of Faith. This comes out in 2012-2013, and this is under Pope Benedict. Great document. Again, if you have never read this particular document, it's a small pamphlet. It's put out by the USCCB. It's excellent. It takes it from a different angle than Preaching the Mystery of Faith, but the purpose of the document really is not only for those who preach, but for those who teach those who are going to preach, as well as those who are going to do continuing education. And it's a good document, but the part that I really enjoy most is the bottom paragraph that I have there, the one ordained to preach. And that is the preacher as a man of holiness, a man of scripture, a man of tradition. Here's the best one. Preacher is a man of communion. And it's not necessarily communion as in the Eucharist, but a man of communion with all those under our care. Because as you are somebody who is involved in hospital, nursing home, assisted living ministry, you're not only dealing with Catholics. You've got people of all different Protestant denominations, folks who are Jewish, you have some Muslims occasionally. So you're dealing with people on a spiritual level from a wide spectrum. I have a little thing here on Evangelium Gaudium, the joy of the gospel. And I'm going to go down to the third paragraph, number 145. Preparation for preaching is so important a task that a prolonged time of study, prayer, reflection, and pastoral creativity should be devoted to it. Some pastors argue that such preparation is not possible given the vast number of tasks that they must perform. And I'll digress for a minute. There's a story I usually tell to most of the students here when they say to me, "Oh, Deacon, you don't understand. We're going to be really busy. We've got funerals, we've got this, we've got parish meetings, whatever." I just nod my head and I say, just let me share this with you. I'm married. My wife and I have 4 children. I was putting in 20 hours a week in the parish. I was fire department chaplain. I did a master's degree and a doctorate degree. You're not going to be that busy. You may be close, but if I could do that, if I could spend the time necessary to put a Sunday homily together, you will find the time to do it because you've got to make the time. That's when we meet our people. Now, when we preach in a hospital nursing home setting, that's a whole different ballgame. We'll get to that in a moment. Last one, last page there, it says a homiletic directory. This came out of Pope Francis. This is a little different. What I like about this document, and again, if you don't have a copy, please find one of these for yourselves. It has a little bit about preparation and interpreting the Word of God, but it goes through the entire liturgical year. It's got the Triduum, all the Sundays of Lent and Advent, Christmas season. It's got every single weekday. Talks a little bit about weekday Mass. That's a whole different ballgame, by the way. For those of you who are priests, you can be preaching on the Gospel of Luke on Sunday, but you're preaching a very similar passage during the week, whether it be Matthew or Mark, and you're taking it from 2 different angles. Preaching on weekday Mass, you get to know the Scriptures real quick, because it's a 2-year cycle, and a lot of times it goes in tandem with the Sunday readings, but just from a different angle. So, if you're ever looking for a topic, like you say to yourself, "Oh man, I'm just lost. What am I going to preach about this weekend?" A homiletic directory on the back end, on cycle A, cycle B, and cycle C, it has every single Sunday, and it's all correlated to the Catechism of the Catholic Church. It's got 3 or 4 different things that you can look at and cross-referenced. All you have to do is look at that, and something will pop into your mind, and it'll send you off on a tangent somewhere. Good document to keep in your homiletical library. I'm just going to go one more thing. I have some various quotes that I pulled out of Fulfilled in Your Hearing for you. All 3 of these quotes, I think, are extremely important for what we do as preachers. Here's the first one. This goes right along with what Deacon Anton was talking about before. Only when preachers know what their congregations want to hear will they be able to communicate what a congregation needs to hear. That's key. We can preach on what we think of the real issues, but if we don't know, if we don't have, what's Deacon Anton's friend there, Bob, if we don't have a Bob in our congregation, somebody's got to give you a clue what's going on. So remember, just as other people have said the same thing, we have a copy of our homily in our pocket in case somebody says, "Oh, you said this." "No, I didn't." "Oh, yes, you did." "Well, here it is. If you can find it, let me know. Because remember, communication is not what's said, it's what's heard. People don't always hear what you're saying and vice versa. So that's an important quote right there. The next one. The preacher represents this community by voicing his concerns, by naming its demons. In a hospital or a nursing home situation, the demon is real. The demon is the disease. It's the loneliness. It's the depression. We enable to gain some understanding and control of the evil that afflicted. The preacher represents the Lord by offering the community another word, a word of healing and pardon, of acceptance and love. And the last one. The preacher acts as a mediator, making connections between the lives of people who believe in Jesus Christ, but are not always sure what difference faith can make in their life, and the God who calls us into ever deeper communion with himself and with one another. And all of these statements are very applicable in any preaching situation. But when people are facing death or critical illness, If we take the time to construct a homily that we identify with the struggles, with the pain, with the doubts, with the joyous moments, then we know that we're able to enter into this with our people. Now sometimes you're going to find that you go in and, again, just out of curiosity, how many of you might do a community service at a nursing home on a fairly regular basis? Okay, quite a few. It's different. Sometimes there are hospitals that have chapels or actual parishes that are built into into a hospital situation sometimes. The nursing home that we were at we were kind of unique. It was a 4-story building. And we had a rehab center, we had a long-term care center, we had a memory care unit, we had a psych unit, we had a gero psych unit for those who are older with psychological problems. Now, just as an aside, if you really want to have a great time, you got to do a Bible study on the psych unit. It is awesome. These folks, they will give you questions that you'll be shaking your head saying, I don't know the answer to that. I want to find out for you. And by the time you get back and give them the question, they forgot all about it. But that's okay. You've learned something from it as well. But we also, at this facility, we had daily Mass, Monday through Friday, and we had one Sunday Mass. When I first got there, we had 3 priests. They were all over the age of 80. Unfortunately, in the first 2 months, we lost 2 of the priests. They died. And very quickly, it was just one priest who was about 84, 85 years old, and me. And he came to me and he said, Steve, I can't preach every day. He says, can you take Monday, Wednesday, Friday? I said, sure, I can do that, no problem. He says, oh, and Sunday? I said, well, Father, I still have 4 other parishes I got to do on the weekend. So, just like Deacon Anton, I preached 4 Masses, 4 different parishes every other weekend. And on the weekend I was off, I would go and preach the Sunday Mass down at the nursing home. So, when you start preaching that often, number 1, you get pretty good at it, especially daily Mass. Number 2, you get to know your congregation. And the congregation at a nursing home is different than an assisted living, and it's different than at a hospital. Hospital, you kind of go in and out real quick. People are there for a week, maybe, sometimes 2. That's about it.
They get kicked out a lot earlier now.
Yeah, that's right. Right, only 2 or 3 days.
Yeah.
Right? But at a nursing facility, you get to know these folks because they're there sometimes 6 months, a year and a half, 2 years, whatever it might be. So when they come down for Mass, it's a whole different ballgame. So and this is, of course, painting with a broad brush. In a hospital, you have a patient. It's short term. Typically, we'll be going somewhere else, either to continuing care, or treatment, or physical therapy, something like that, within a couple of weeks. But at a nursing facility, you've got residents. They're long term. And often they're people at advanced age. They might have chronic disease, could be a terminal illness. Some of them will return to a family setting, some will eventually transfer to hospice, and some may die at the facility. And again, you know who these folks are because you see them all the time. You visit them perhaps weekly. In my case, it was probably every other day I saw all 138 people. And therefore, I had a relationship with these folks. You form long-term relationships. So just as in a parish, we have long-term relationships, and you know them because you've done the baptism in a family, you've married this couple, you buried their parents, whatever it might be, you gave their kids first communion, you've established a relationship. Here, it's different, because in hospital or nursing homes, we understand that people are in a different mindset. There are certain things that are very important to them and other things that have no meaning at all anymore. You could share some of that, Jana, what your experience has been.
So just kind of piggybacking onto, when you talk about the different units in a nursing home, it used to be many years ago that, nursing homes were primarily for long-term patients, and that's pretty much all you had. Most nursing home settings now, you'll have your long-term care. You might have a separate memory care unit. A lot of times those units are, what are called locked units, because folks with memory impairments tend to wander, so it becomes a safety factor. But also you have rehab units, and this is usually a step down from the hospital. So again, with the way that healthcare is in our country now and with insurance changes, people don't stay in the hospital as long as they used to. So they still have a lot of acute nursing needs, a lot of acute therapy needs. They come from the hospital to a nursing home rehab unit, where they continue to get treatment for might be another couple days, might be another couple weeks, and then either they go home or they go to another setting. So your folks that you might be seeing from the rehab side, some of them are going to be, maybe it was I fell, I fractured my hip, I'm doing therapy, I'm keeping up with my pain management, getting back to where I was and going back home, getting back to my life. A lot of your folks that you're going to see on your rehab units now too, though, are dealing with a lot of life-changing things. So even though they might not be staying at the nursing home and they're going to go back home or they're going to go to maybe assisted living or another setting, these are folks that might be, they went to the hospital because of, abdominal pain and all of a sudden found out that they have metastatic cancer. They had a stroke and now they have deficits from a stroke and they're trying to learn how to live a new life with that. They had an amputation, they're trying to learn how to live with that. So it's not always okay, I'm going to get better and go home. It's okay, my life has totally changed and I'm trying to learn how to deal with these changes. Then you have your folks on your long-term care units who are probably going to live the rest of their lives in that setting. And these folks, they may have memory impairments, they may have developmental delays. I've had folks on units like when we worked at the Mount together that had like Down syndrome, or other developmental delays where they were 60, 70 years old and in their mind they're still a child. A lot of folks with dementia are going to regress to their childhood years as well. And then you have folks that are they're older, they have a lot of chronic health issues, and they've had exacerbations and kind of the roller coaster of chronic health issues flare up. And then they kind of go back down, and they flare up, and they go back down, and eventually people just start to decline, and then eventually we'll probably transition to a hospice. One thing, though, that kind of is the same with all these populations is that, again, a lot of folks have spiritual needs. A lot of folks, even if they don't remember, especially our dementia patients, if they don't remember anything else, they're going to remember if they're Catholic, they remember their Our Father, they remember their Hail Mary, and the amount of comfort that people will get from that when they can't even recognize themselves in the mirror anymore. The number of times that I've said an Our Father with a patient, while helping wash them up in bed because that's what calmed them down, is I can't even count how many times.
And it's not only the Our Father and the Hail Mary, but a lot of times it's going to be cultural or linguistic. So for me, I was when I focus on elementary, I speak a little Spanish, I can pray Padre Nuestro, I can pray the Our Father in Spanish to somebody, but I can't carry an entire conversation. I know enough to be dangerous. I know enough to be dangerous in Italian, because I served in the Italian National Parish for a year. I'm okay with that. But when we were up in Maine, the primary language was French. There's a lot of French Canadians. All I know is, allez dans la paix de Christ, go in the peace of Christ. That's about it, But a lot of my nurses with CNAs, certified nursing assistants, spoke French. And I would bring them in to pray the Our Father in French for these folks. Because what's interesting is with memory loss, there's two things that people remember: prayers, and the other is music. People, they don't speak at all. And all of a sudden, they'll be praying the Our Father, the Hail Mary, whatever language it might be. And then you start putting on show tunes from the 1940s, and they start singing. It's amazing. The mind is a strange thing. It's a wonderful thing. But the prayers and the music are very, very important. And the thing is that all of these people that are in these facilities, like we had a Catholic nursing facility, but there's Catholic and there's Catholic. Are they a strong Catholic? Are they a nominal Catholic? Are they a minimal Catholic? Father Mark likes to use the term, are they a creaster? You know, Christmas and Easter, that's it. You know, whatever it might be. He says people come and they come with different varying degrees of their faith and what's important to them. We've had people that were at the nursing facility who just was so involved in their parish and for the last 6 months or a year couldn't go to church. And sometimes I'd see like a woman just sitting there and she said, you know, I used to be a lector at church. That's awesome. Would you like to be a lector here at the nursing home? Oh, but I can't stand the lectern. It's no problem. Give her a microphone, she'll stay in her chair. The whole face lit up. All of a sudden she was a lector again. She was somebody who was practicing her faith in a different way. It was very important for her. Now, of course, in any facility, you've got people who are fill in the blank, Methodist, Lutheran, Episcopal, Baptist, Presbyterian, whatever it might be. Sometimes you'll have folks who are Jewish, you'll have occasionally some folks who are Muslim, but you'll also have a lot of nuns, and not the ladies with black and white headdress. N-O-N-E-S. They have no tradition. When they have no tradition, sometimes they'll be very adamant. But you know what? Death is the great equalizer. And all of a sudden something happens in their life, and they realize where they're going next. A case in point, we had one gentleman, he came into the facility one day, and kind of a gregarious guy. So I said hello one day, I just knocked on the door, and I wouldn't say, hi, it's Deacon Steve. I'd say, hi, Steve is the chaplain. I didn't know what religion he was. And I said, hi, Steve, it's chaplain, just coming to say hello. Get the hell out of here. I don't need anybody from, no God stuff here. Don't bother coming back with this God stuff. All right, I'll see you in a couple of days. Come back again, knock on the door. Hey, Steve, the chaplain. I told you, no God stuff here. Oh, I just want to tell you that the Patriots are horrible. What do you mean the Patriots are horrible? And we got a whole conversation going about football, and then I told him that the Red Sox were even worse, and that really set him off, you know. But we developed a relationship so that I come in and we tease each other about sports teams or whatever. And, you know, over the period of 6, 8 weeks, we got to know each other fairly well. And then one day, I came up and the charge nurse said to me, you know, so-and-so just got some pretty bad news. He may not be here with us for another week or two. Hey, Steve, the chaplain, how you doing? Got a few minutes? Can we talk? That was about a 2-hour conversation. Trying to set him at the right place where he needed to be in his relationship with God, because it was less than a week later he went home to God. So you're meeting people on a whole different level. You're also meeting people where the confines of their existence have been reduced. This is your audience here. They came from a 4-bedroom house with 6 kids in it, and then they downsized to a condo because all the kids grew. They're in a condo, and then one spouse passes away, and then they went to live with their daughter or son-in-law in a small little mother-in-law apartment. Then they came to the nursing home, and then they come to a hospice room. And now their existence is pretty much from where Jana's standing to me and about here to here. It's a bed, a dresser, and a closet with 1 or 2 changes of clothes. We came in with nothing, we go out with nothing. And again, it's our mindset as we realize where these folks are at. Number one, it's very sobering for us, especially as preachers, because we confront our own mortality, and we confront what's going on with the audience that we'll be preaching to on Sunday in the nursing home or in the hospital, because people need to hear certain things. Now, of course, there's certain topics that are for everybody. But when it comes to some of the things that we need to talk about in this venue, hope, fear, trust, acceptance of faith, the importance of family, prayer, love of God. There's a big one, life after death, and community. Because a lot of people that are there in this community, they're in the same boat. Doesn't matter whether they were millionaires or not. Doesn't matter whether they lived on, EBT cards and whatever else. They're at the same spot. They're in a position where they're moving closer and closer to God. But sometimes I used to ask myself, now why are these people coming to Mass and they're not even Catholic? I started to think about it. Then I realized that there might not be any other service available, so they'll come to Mass. Why not? They may know the Catholic chaplain and have a relationship with them. But a lot of times, it gives them the opportunity to escape from their room, to get out of this one little spot that they've got, to be with other people. And eventually, the Word of God starts to permeate their being. The Word of God, Isaiah 55, and so shall I send my word out. It will not return to me void. It will achieve the end for which I sent it. I'm a firm believer in that God sends out His word, and it does this magic, so to speak. I'll tell you one or two stories. I'm sure you can share a few of these. But there was this one particular woman. She was, I'll call her Sarah. That's not her name, but we'll call her Sarah. Sarah was a big woman. She had to be, I'm going to say 500 pounds, I'm sure. Huge woman. Had a special bed, special chair for her. And she was ornery. I mean, really ornery. You walk in, get out of my room. I don't want to see you. I kept going back, and she goes, it's you again. I told you to get out, And I kept coming back. And we started a conversation at one point. And in that conversation, something struck her. And she says, oh, well, tell me, why do you Catholics do this whole thing with Mary? We had this whole conversation about Mary. And then she says, where do I find Mary in the Bible? I goes, oh, I showed her a few different spots, Birth of Jesus. Started going. She says, I see some of these people with these beads in their hand. What is that all about? Oh, the rosary. I said one of the other chaplains and teach you how to do the rosary. And then she said, I think maybe I'd like to come down to Mass. This woman was in the Gero psych unit. She has some difficulties. And sometimes we didn't want to bring her down to the general population because she could be very disruptive. And I said, no, bring her down. If she's disruptive, we'll take her out of the Mass, no problem. But she started to stay more and more. And things started to get bright for her. And over the next year and a half, she probably lost about 200 pounds of her own volition. It wasn't that she was ill. And she started to feel better about herself. She came to Mass almost every day. And she said, I think I'd like to be baptized. Called the chancery, got, to baptize her. First communion. And we ended up, about a year later, that she had a Catholic funeral. But it was a great journey for her. And again, that journey probably wouldn't have happened had she still lived on the outside. But because of where she was, she had the opportunity to listen to God's word. She allowed that word to enter into her heart, into her life, and it changed her. The other person that I think of is a woman on a psych unit. You know exactly what I'm talking about. She was a character. And, but I'll tell you what, when I came up for communion, she sat there just like the nuns taught her. She sat there, she received communion, she listened, she prayed, she always said the Hail Mary, the Our Father, she did an act of contrition, she was unbelievable. Of course, what she did afterwards was a little wacky, but that's okay. She did what she did. And when she was formed as a good, strong Catholic woman. She had a lot of substance abuse problems. But again, somebody who was very interested in her faith, and she came to Mass every single day. And one of the that I'll just mention is that we did have a couple that came in together, and a lot of times when a couple would come into the nursing home together, we would not have them in the same room. And you say to yourself, well, that just sounds so unfair. Why would you do that, But what would happen is if you had the couple in the same room and, John was there and Martha wasn't feeling well, John would get up out of bed to go help Martha. John, of course, couldn't walk, because either he didn't put his prosthetic on and he'd fall down and hurt himself. So we kept them separated in the evening so that we could watch over them, kept them together during the day, they could spend time together. But this one particular couple, they were celebrating their 75th wedding anniversary. It was awesome. You know, how many people can be married 75 years? And we had the local TV stations came down, we had a special mass for the two of them. So a lot of times in a hospital nursing home setting, there's a lot of joy that comes out in addition to some of the difficulty. But your audience, you're preaching not only to the residents, but you're preaching to the nurses, to the CNAs, certified nursing assistants. You're preaching to the staff, to the folks who are cleaning the beds up, or sweeping the floors, preaching to the doctors. And you're also preaching to the family members of those who come to Mass there that particular day. And the people who come to Mass there, they form a very, very specific community. We try to utilize them as lectors, as Eucharistic ministers, because even though they belong to local parishes, often enough they would come on that one Sunday Mass to be with their family members so that they were able to participate with them in Mass. So there's a lot of people that you're entering into relationship with. Anybody in particular that you can think of that you wanted to share about?
I was just thinking, I worked a couple of units over at the nursing home we worked at together. I worked on the rehab unit for a while. I also worked on our memory care unit for quite a while. And we had one gentleman, I'll call him Billy for this story, but Billy was in his probably later 60s. He had some developmental delay, so in his mind he was still a child. And his mother was actually a resident on one of our other long-term care units. So his mother was in her later 80s, early 90s, if I remember right. And when Billy's mother transitioned to hospice, we would, take him over to the long-term care unit so that he could visit with her, and try to explain in a age-appropriate for him way what was going on. And he was raised in a very strong Catholic home, and he would always wear a cross. And so even though there were a lot of things that maybe he didn't quite understand, after his mother passed, he would still come up to me, weeks and months later. He would take his cross, he would show me his cross, and he would point to the ceiling and say, Mama Heaven, Mama Heaven. Because he held on to that faith even when he couldn't understand a lot of the nuances. And that was such an important thing for him.
And the same guy, when he would see me, he pointed to the cross and he'd point to me because he knew I was the deacon. He'd go, yeah, okay, thanks. But in his own way, you again, form that relationship. It was really, really important. Then there's something to think about is that you have people in your parish that have been there forever. They've been there for 30, 40, 50 years. And then one day, they're not there. Yeah, well, maybe they're sick. And the next week, they're not there again. 3 weeks go by, 4 weeks go by. And then you kind of, not that you forget about them, but, the weeks just go by. And we have no idea that this person is now in a hospital or a memory care unit or assisted living, whatever, because nobody tells us as priests and deacons in the parish. We've got no clue where they're at. It would be nice to know if we knew where they were at, and we could go bring them communion and go visit them. But these people are taken from their worshiping community, and for years that community has been very much a part of who they are. And when the ministers don't know, we don't know until we find out that they're at a facility, or unfortunately, we don't know sometimes until they've passed away. So the people who are in the pews are very important for who we're preaching to. In addition to the various jobs they may do at the facility, there's also things to deal with, just like in any parish. Culture, race, religion. And religion could be Catholic, but I know like up in Maine, we also had a very strong Maronite community up there. And the Maronites are wonderful. If you've ever been to a Maronite church, by the way, it's awesome. Their book on the altar is in 3 columns. It's in English, it's in Aramaic, and it's in Arabic. So the priest has to be trilingual in order to celebrate Mass. And they had a very strong Maronite community there who had some roots in our nursing facility. There was a deacon there who was ordained many, many years ago, probably one of the first guys around, like 45, 50 years ago. He's since passed away, but he was just a tremendous support to me when I first got there. Language. Do you know another language, whatever it might be? Because sometimes somebody comes in and they're speaking some language, I'm saying, I'm not positive. Oh, it's Polish. Oh, okay. Somebody's going to speak Polish in the facility. We would find somebody to go and have a conversation with them. Are there certain family practices or prayer practices that are important to this person that's at the nursing facility? Are there somebody who said the rosary every single day? Is it somebody who went to prayer sometimes? You know, a lot of people back in the day would go to prayer at lunchtime. You know, they hear the Angelus, they go to prayer for a couple of minutes, and then go on their day. Maybe that's important to them. Need to find out. The other thing that I found, and for many of you, especially for deacons, you'll appreciate this, is that in terms of education, I found myself having to educate all of our nursing staff that for end of life, what's euphemistically called last rites, we don't have to wait to the last possible breath before we call the priest. And some of them would literally do that. He's got about an hour, maybe two. I'll wait and I'll call Father then. Well, now it's 3 o'clock in the morning and come on, give me a break. So what we started to do is that if somebody was older, with a lot of difficulties, as they were brought into the facility, we would have them anointed right away so that they were anointed. And this way, that God forbid they passed before we got to them again, not to worry. Because people would be very upset if they weren't anointed. But their families were not of the name. They were in California, they were in New York, they were all over the place. And they maybe only got to visit them once a year, maybe twice. So this community, these nurses, these aides, they became the family to those who were in the facility. For me, one of the most just heartwarming moments of my life was going into somebody's room, and I saw this one aide, really not supposed to do this, but she was laying next to the woman in bed and just stroking her hair and talking to her very, very peacefully. You know, the only thing I thought of was the visitation. You know, just that warm embrace, just for that one moment. It was so powerful to me to watch that. But there were moments like that over and over again. Those are the kind of things you might want to address in your homily. That there are so many moments of intimacy before we go home to God. There's so many moments that are still left before we go home to God. To be able to talk about asking for forgiveness, to be able to grant forgiveness to somebody who maybe has been difficult in our life. All of those things are possible. And of course, you know, like this one particular woman who I called Sarah, maybe there's a desire for baptism or first community, whatever it might be. How can you work with that? So there's a lot of ways that we can help people in these facilities and in hospitals. Anything else you want to add to that?
Just to kind of add on there, particularly if you're visiting, you know, I know we're talking about like preaching more in maybe a mass setting or whatnot, but when you're visiting people individually on the units, I can't speak for all staff because some staff, if you approach them, they're going to be like, I'm too busy, don't talk to me. But most of us check in with us if you're coming in to see somebody, because there's a lot of information we can give you about, you know, maybe what we've noticed in terms of maybe their spiritual needs or their faith traditions, you know, because a lot of times we will see people praying, we'll see people reading, you know, we'll hear family discussions, you know, we hear so many stories of, you know, people's previous traditions. There's a lot of information that we can help share to help you to be able to connect with folks. And particularly when it comes to end of life. Come check in with the nursing staff, come check in with one of the aides. We spend, a lot of times, we're spending 12 plus hours a day with these folks and these families. And we really get to know them, and we can say, hey, you know, maybe the best way to start an approach might be like this as opposed to like this. Or, hey, you know, this person had a stroke and they neglect one side. You know, when you come in to talk with them, make sure you approach from this side. There's a lot of things that we can share, and a lot of us want to share to help you be able to meet their needs best. So most clergy that I've worked with, they come and talk with me, or you know, one of the other members of the staff. But I have had occasionally where I've called for a clergy member specifically at end of life, and the only reason I knew that he came was because I saw him walking back out the door. So it means a lot to us if you check in with us as well, because there's a lot that, you know, that we can share with you. Also just want to talk a little bit about some of the wide range of emotions, you know, that you're going to be dealing with for folks, whether you're seeing them on a unit, whether you're, you know, preaching in a setting. Folks who are dealing with any sort of major health issues, I mean, you're going to be dealing with fear, you're going to be dealing with hopelessness, you're going to be dealing with helplessness and frustration. There's a lot of loss of independence for folks in long-term care settings where, again, they're down to one room, things that they used to be able to do for themselves, they can't do anymore. So things like, you know, I can't dress myself anymore, I need help to go to the bathroom. You know, eventually can't get out of bed to go to the bathroom. Now I need a bedpan. You know, I need help with all these things.
Not only the resident,
yeah,
but also the caregiver.
Mm-hmm.
And that's somebody who really needs to hear from us, or we need to hear from them as well.
Yes.
Because the caregiver bears the greatest brunt that all of a sudden their whole world is turned upside down, that the person that they love and have been working with and living with all these years, nothing can happen now. Person, like I said, they can't get up, they can't walk, they can't talk, they can't communicate, they can't go to the bathroom.
Mm-hmm.
And this person now becomes literally someone who their life will change dramatically because all of a sudden they realize different things. Here's some of the things that a caregiver is going to have to realize. Number one, they're doing God's work now. They are helping their loved one at a point where their loved one cannot do anything anymore. They are now a person of complete support. They come to realize that they are a human being, not a human doer, but a human being. We're not Superman. We can't do it all. And there may be a point in time where that person can't stay at home. They'll have to go to a facility or an advanced facility, whatever it might be. For a caregiver, they come to realize that at some point, you've got to be kind to yourself. Because you beat yourself up. Oh, I can't do enough, I can't do enough. You can't do enough. Be kind to yourself. And there are a few things that become very, very important. The importance of silence. You know, for any of us who like to spend any amount of time, especially sitting in adoration, that's an important time. But even if it's in silence, sitting down by the lake, the importance of rest, of sleep, to be able to go to bed and sleep even if it's 6 hours a night, something. The importance of prayer. That even if you have not been a prayerful person to this point in your life, you will be now. Because you realize that we can't do it alone. God sends us into the storm, and in the storm we find that God speaks to us. And ultimately, you've got to come to a point where you have to realize, I got to share the load. And as a caregiver, whether that load is going to be my sister, my brother, my cousin who can help out with my mom, whatever, or it's somebody that you bring in who's, you know, a paid professional, whatever it might be. But I think the overlooked people a lot of times in nursing homes, hospitals, that kind of thing, are the caregivers.
Yes, and there's a lot of guilt that a lot of a lot of folks, especially when they say, I can't manage this at home anymore, and, someone comes into a facility setting, they feel like I failed, I couldn't do this, and it's, people need a lot of support to realize that, no, you did not fail. Now, we as the staff, we can take over that caregiving, and you can step into the role of family and family support, which is a role that is unique to you. We can't do that part, so now you get to focus on that. We can focus on the rest of it. There's also a lot of guilt that I often see with folks diagnosis-wise, particularly when it comes to cancers in particular. Things have gotten better over the years, but there's still a lot of phrasing like, you fight cancer. And this phrasing, a lot of people feel like, okay, when they get to the point where it's time to have that conversation of, okay, what are our goals here? There's nothing else we can really do in order to treat the cancer. Let's start maybe looking at more of a hospice, palliative focus. And people feel guilty, like I'm letting go, I'm giving up because of just all that. Well, you got to fight this. You got to beat this disease. You got to fight this for your loved ones. So just especially when you're working with folks, especially with cancers, that's a whole other layer of support that they often need.
Let me end this with the word hope again. This year is the year of hope. The Holy Father's given us the Jubilee year of hope. So there is a human need to hope, a human need to pause, to reflect, to pray. When we deal with folks who are in nursing homes, hospitals, facilities, whatever it might be, we're dealing with folks who often are elderly, but they could be young too, but they're sick. Oftentimes they're alone. Sometimes they're incarcerated. Sometimes they're strangers, the people who are fleeing persecution. Could be young, but all of them are uncertain about where they're at and where the next step is going to be. So hope and journey are pretty much related concepts because both are oriented to the future. And many people, such as Pope Francis, have described facing the future with dread or despair. And for them, the future promises only illness or loneliness, rejection or deprivation. But as preachers, we can bring about Christ's compassion to a person who thinks that they are alone, thinks that they're alone in their illness or their isolation or their worry. If we acknowledge this person's existence, we acknowledge their value, we acknowledge their membership in the community of the church, we acknowledge the fact that God is with them on this journey, we're going to be able to give them hope. And that hope will gently lead them home. So we hope that this has given you a little idea of a ministry that many of you are familiar with, but I would encourage you to really develop that side of your ministerial life. Because people need us to be out there, not only pastorally, but wherever we can preach in these units as well. One of the other things that I found that has been important is that on any unit in a big facility, people who are in one particular area for 3 months, 6 months, a year together, they get to know each other. And when somebody dies, all of a sudden that room is empty. And then 24 hours later, somebody else is in there. Because he comes and goes, it's business, that's how it is. And those folks might not be able to get down to a mass or might not get to the funeral mass because it's in a parish somewhere. So what we decided to do back in the day was that we would have a little service on the unit for those residents who lived with that person and also for the staff that got to know that person. Very small, might be 10 people. And we'd allow them to share a little bit about the individual who died and to share about their own fears and worries. That was very, very important. Something that helped a lot of people. So I share that with you as something to think about. That it's not only the family of the deceased, not only the person who is on their way to God, but those who are immediately around them, who might not be family, but who will have a stake in that person's relationship, you know? So be kind to them, be kind to yourselves, and God bless you for your ministry. Thank you. If you have any questions for Jana or I,
it might seem like a basic question, but what kind of hope? Hope for eternal life, or it's not hope that they're going to get better, or hope they're not going to get out of the nursing home, they're probably there for life, so what kind of hope?
well, you know, when you think about it, when people ask you to pray for them, and they want healing, typically they want to be healed, they want to be able to get up and, you know, go run a marathon or whatever, right? And there's always some type of healing. The healing might not be physically. It might be spiritually, emotionally, psychologically, and that's some of the hope we could bring for some of this. But a lot of it's going to be spiritually. Because you're right, the vast majority of folks that are 85, 90 years old, their next stop is going to be with God. But where's the hope in that? None of us are going to be here forever. There's no, how's the expression go? None of us gets out of this world alive, you know? We all go home to God at some point. Some are 2, some are 102, but somewhere in between, we're going to do that. So the hope is that, you know, if you read John 14, 1-6, you know, there's a room in the Father's house. What's the room in the Father's house that you can envision that you'll be at? To be with your grandparents, to be with your parents, to be with your brother and sister who have died before you. But the hope has to be that there's more to life than just this. And that life with God is eternal. This, you know, here on this earth, this is a short run. Eternity is forever.
How do you deal with the arguments between siblings that argue about what care to take? You know, some say keep them alive forever. No, that's tough.
Yeah, that is borrowing this here. That gets to be a huge challenge, and particularly in my years of hospice, I have dealt with that a lot. And that's a lot of times where we will bring in social work, we will bring in chaplain, because it's kind of all hands on deck. You know, a lot of folks, I mean, nobody wants their loved one to die. You know, we all want to be here with each other forever. And a lot of folks too, especially our folks that are on our long-term care units, you know, it's like, well, they've had exacerbations of their heart failure before, they've had infections before, then they get better. Why are they not getting better this time? Because now God's calling them home. You know, the body's an amazing machine, but eventually it gives out. So then, yet you have, okay, well, no, we got to keep treating, we got to be aggressive, we got to do this. And then someone else like, oh, no, like it's been a roller coaster for years. Let's focus on this. Exactly. So it can very much be a challenge of trying to listen to everyone and make sure that they feel acknowledged. When it comes down to it from more of a legal standpoint, this is a moment where it's very important to have discussions ahead of time on what your wishes are and what your wishes are not. Get these things documented, having a healthcare power of attorney in place, so that when it comes time that you cannot make those decisions anymore, there is a legal document that says, okay, we've had this conversation, this is what, you know, mom wants, what dad wants, what they do not want, here are their healthcare power of attorney agents, and then we do something that's called activating the power of attorney, when someone is no longer able to make their own decisions, to physicians certify, okay, yep, they can't do it anymore, so now whoever's first or second, they take charge. So that's kind of a moment where we really are trying to make sure before we get to that point, let's start having some conversations. But unfortunately, sometimes you eventually get everybody on the same page with just, again, listening bit by bit, and then just being like, okay, this is what I'm seeing, this is what I'm seeing, this is what we've tried. Sometimes it's okay, we'll try this. You know, let's try treating this infection and see if it works. And if it doesn't, okay, maybe we need to change tack. A lot of times people end up then eventually on the same page. Sometimes they just never are going to, and sometimes, unfortunately, it just stays ugly no matter what we do. So yes, power of attorneys, everybody, please.
Thank you very much. The church's teaching on end-of-life issues is beautifully nuanced. And while not resolving all difficulties in pastoral situations, you can certainly confine the conversation within the concept of faith. We don't want to hasten death, but we don't want to unnecessarily prolong life. And so we have some beautiful ways in which to talk about that, and that teaching can be spoken about in very pastoral ways. I wonder if you might be able to comment on the importance of the Catholic minister understanding that as he brings it in a pastoral way to those who are facing death imminently.
It's interesting because one of the priests that passed away when I first got up to Maine, one of the priests, he was a priest for about 50 years, and he developed cancer, and he developed, oh my goodness, he had like 3 or 4 different things going on. And he got to the point where he had to be on dialysis. And dialysis just drains you. You know, it's 3 days a week. The next day you're in horrible shape. Then you're in bed for a day. It's a very difficult route. And one day he just said, you know, I think that's it. I'm going to just stop the treatment because I'm going to go home to God pretty soon anyway. And it's not that he's taking his life. He's just limiting the treatment that's available at that moment in time. I mean, a lot of times when somebody needs a feeding tube, is that in their end-of-life wishes? Do they want a feeding tube? Do they not want a feeding tube? Are they going to use extraordinary means or not? And those are the things, those are the conversations that Jana was talking about in terms of those plans, wherever you can have that in place beforehand, that takes a lot of pressure off the family, and a lot of pressure off the facility as well, because they don't have to guess what's going on. But that education piece, I think, is something that any of the nurses, the doctors typically don't seem to have the time to do that, but the nurses will a lot of times have some extra time to be able to educate people, but clergy too. As clergy comes in, to be able to say to somebody, this is what the church teaches on end of life, and here are some of your options. What do you want to do? Now, of course, you get into the whole thing with the siblings.
Right.
I'll do everything I can to keep mom going. And I think of that one guy, you know what I'm talking about?
Yes.
His mother was going to live to be 115, it doesn't matter. He was going to do anything possible. And when she died, he was just devastated.
So that was his whole life.
His whole life was
Being a
visiting.
caregiver to her was his whole life.
Exactly.
So then it's a huge loss of identity then when she passed.
Right. Yeah, he had no idea who he was anymore. He was the caregiver to his mother. So. Anybody else? Deacon Ted.
If I could share two things that kind of exemplify what you were talking about. First of all, Jana, thank you for being a deacon's daughter and loving on your husband, on your father, and your dad. It's not easy sometimes. And that's with all due respect to Deacon Steve. No, it's a unique situation to be a child of a deacon. So thank you. So the memory care unit, the locked behind. The lady from Colombia, she spoke fairly decent English. This was during my formation, visiting. And I would bring a corporal with the fix on it, put it in the middle of her bed. She would just touch the edge. You could tell she was being very reverent. She would pray the Our Father, but it almost reminded me of the woman touching the fringe of Jesus' cloak. The second, my father-in-law was in hospice back in 2017, 2018, something like that. He was from the Dominican Republic, very proud man, had throat cancer. And I'm sitting there going, I need a DVD player. Okay. I couldn't find a DVD player anywhere. And somebody said, your phone, YouTube. And I put merengue and bachata on. And this is all within 24 hours of his death. and he just kind of sits and starts moving. Later that day, son-in-law, I walked him, carried him basically under his arms, naked, to take a shower. Yeah.
A lot of what we're talking about here is, I keep using the same word, but it's the only word I can think of. It's just intimate moments of life. And wherever we can share that, we are really bringing Christ into the intimate moments of life. Whether it's in our preaching, in our actions, in the conversations that we have to people. So be kind to others, be kind to yourself. Thank you very much. Mike?
One quick question.
Sure.
What was the citation from Jeremiah you used for the opening prayer?
29, 11 to 14.
Thank you.
Before we say the address, we got a couple of minutes.